Are living with right now, varicose veins, and those veins could be an indicator of a deeper issue.
Charlene Shirk is at Coastal Vein Vascular Institute to find out about different vein treatments. Charlene?
Well, you know, that's exactly right. Everybody's been taught that varicose veins, they don't look good, you want to do something about it, but they actually could be a signal for a bigger problem. So the folks here at the Coastal Vein Vascular Institute want to help you take your first step to not just looking better, but really feeling better. So I'm here with vascular and interventional specialist, Dr. Doug Gessner, and physician assistant, Crystal Boatwright. Thanks so much for having us today.
Thank you for being here.
And Doctor, great to see you. This is really a bigger issue than just, I want to look good in my shorts and, excuse me, my high heels. It really could be an underlying health problem that you really say people need to get addressed. It could be dangerous.
That's right. You know, venous disease, and we've talked about kind of the process of it, but venous disease is something that we're fortunate because you actually have a superficial or a manifestation that you can actually see. So it starts typically with spider and reticular veins, the little things that you see in your legs. You may notice a little bit of swelling, and you may not think much of it. And most of our patients, when they come here, they're almost embarrassed to be here because they think, well, it's not that bad. But it really could be a representation of something more going on that's deeper that needs to be addressed. But typical minor symptoms are swelling, kind of aching, throbbing. They may notice that at the end of the day, the legs are just kind of tired. They need to elevate their legs. So it really is something that they should at least get checked out because there can be long-term consequences.
And you mentioned an underlying condition. So are there stages of this condition? Like if you don't get in to get this done, something really serious could happen.
Yeah, absolutely. In medicine, we try to classify things. So in venous disease, we have a SEEP classification, and there's really C1 through C6 classifications in venous disease. And C1 is that just spider and reticular vein. C2 is when you have more of the bulging varicosities. C3 is when you start noticing the swelling that occurs. C4 is typically when you start seeing skin changes. You notice redness and it starts getting a little darker pigmentation, which is basically kind of a staining of the skin. C5 is where you actually start seeing that changes with some ulcers or some wounds develop. And then C6 is when you have like active ulcers that just don't heal.
Wow, I never even thought of it getting that severe. And what if you've had treatment before though, Crystal, and you're starting to see something come back? I think people are like, well, I've already dealt with it. I guess I'm just stuck with it.
Well, you know, early treatment is what we recommend to all of our patients. Just as Dr. Gessner said, there's a classification. So patients usually start to notice, you know, aching that only occurs when they're really active, but then that aching and those symptoms will actually increase to becoming more constant and interfering with activities. So the earlier that we treat it, not only the better that will make patients feel faster, but also less treatments that they may need, because that could be a sign that more veins are becoming diseased and damaged.
Now, is this just something that you're born with? I mean, it's just genetics, or is this something that can be self-inflicted? I know I'm crossing my legs right now, and they always tell women you shouldn't cross your legs. Is that kind of an urban myth, or is that an actual way to keep your legs healthy by maybe crossing at the ankles like we were taught?
Well, I definitely sit with my legs crossed, but there's really no evidence to say that crossing our legs can cause venous disease.
Okay, good to know. I'm back in. Okay.
But I do sit with them crossed at the ankles. Yes, it's an inherited condition. There are things that we can do to keep our legs healthy, avoiding prolonged periods of standing or sitting, wearing compression stockings, getting early treatment, and if patients have had blood clots, seeking a second opinion, because there are other things that we can do to help prevent complications, not just medical management with anticoagulations.
And quick question, I'm just going to maybe put you on the spot a little bit. Could some medications also contribute to this kind of problem? Could it be a side effect of some medications that you're taking today? Because you know those commercials, they go on for an hour about side effects.
Not many medications really have any significant side effects that would lead to venous disease.
Oh, that's good to know. Okay, now let's talk about for folks who, like you said, maybe they feel like it's cosmetic and they're kind of embarrassed to come in. But what if somebody's out there listening and they think, oh my goodness, I'm starting to experience some of those symptoms? Can they just walk in the door? Do they need to have special insurance or referral? What's the process to get in here to see this?
Well, we're lucky enough to offer complimentary screenings to break down barriers to care. So that's a quick 15-minute appointment to really discuss signs and symptoms, and if we feel that patients do have venous disease, we'll schedule a full consultation with ultrasound afterwards.
Well, that's great, doctor, because really you just want people to come in, get checked, because your concern is somebody waits until it's a real severe problem.
Awareness is the key. I mean, I like to tell patients it's like having high blood pressure or hypertension. You know, if you don't address it at a young age, there are consequences to that down the road. And as far as venous disease, something that we can manage easily at a younger and earlier stage. But if you wait too long, the consequences of that venous disease and the treatment become much more complicated.
Well, thank you both so much. I think this is really important. I think most people just think it's cosmetic. I don't think they really appreciate the health concerns that can come along with it. And of course, we want to give a special thanks to the Coastal Vein Vascular Institute for sponsoring this segment. And for more information or to schedule your complimentary vascular health screening, please visit coastalvein.com or give them a call at 904-660-2330. Guys, such important information. I'm going to send it back to you in the studio now.
Thanks, Charlene. Well, coming